taking a walk, going on a bike ride, playing with your kids, doing simple yard work, driving a car, even just sitting and enjoying nature. These are parts of our everyday lives. They're something most of us take for granted, but for many people, these aren't normal everyday experiences. For the estimated 100 million adults in the United States who experience chronic, persistent pain, the most simple tasks can be unbearable.
The pain took over my life, not only my life, but my husband's life. We had to change everything. Everything revolved around the pain. Will I be able to go to the market? Will I be able to take the dog for a walk? Will I be able to do some weeding? Will I be able to make dinner? Will I be able to do the laundry?
Kathy had severe arthritis in her spine. Her pain worsened over time and became unbearable.
I lost my life because of the pain.
Everyone experiences physical pain, stubbing your toe, an unexpected headache, even something more dramatic such as a bike or car accident or breaking a bone. But what happens when you experience a lot of pain? What if you've tried different treatments, but it doesn't seem to go away? This can be known as chronic or persistent pain.
So here's something that we tell all of our persistent pain patients. First, pain is a product of the brain all the time for everyone, and all pain is real pain. But another thing that's important to understand is that you can have pain for many reasons besides injury. It's like the brain and the nervous system have become too good at sending a pain message. So if you've been assured that nothing harmful is occurring, then you can feel comfortable that while the pain is painful, the pain is not an indication that you're harming yourself.
Understanding pain is the first step toward changing your relationship with it. Where does pain come from? Why won't it go away? Why is it sometimes more or less severe? Why does it seem to affect some people more than others?
When you injure yourself or experience pain suddenly, it's called acute pain or short-term pain. The injured tissue sends a danger message up to the brain. The brain processes that and sends a pain signal out to the body. Over time, as the tissue heals, that danger signal becomes quieter and quieter, and the pain signal from the brain eventually goes away. Pain really does start in the brain. Ongoing pain, what we call persistent pain, has less to do with tissue damage and more to do with the sensitivity of the nervous system. The tissues have usually healed within a few weeks, and the danger message from the body may be quiet, but the brain is still playing a loud pain message.
So at that point, it becomes important to retrain the brain and the nervous system. And a key part of this is understanding what pain is. And by understanding what pain is, you understand the many ways that you can change your pain experience and quiet your pain.
Whenever we talk about pain, we need to think about the role of medications. Medications can play an important role, but it needs to be the right role. When you have short-term or acute pain, careful use of prescribed medications can be an effective way to manage your pain. But there is a limited effectiveness of using pain medications for long-term pain. They lose their effectiveness over time and can create other problems. Pain medications are a short-term solution. In persistent pain situations, it is critical to learn the skills to change your brain and nervous system.
While pain medication has limited effectiveness over time, the brain has many ways of changing your pain experience. It's important to understand the mechanisms of how the brain works and how it relates to pain.
When a danger message gets up to the brain, different parts of the brain make a decision about how important that information is and create the pain response. And this is where pain can increase or decrease. These parts of the brain are usually having to do with thinking, feeling, sensing, and acting. In the problem-solving parts of our brains, the brain can make the pain greater when we're confused about why we're still having pain. But pain can decrease as we make sense out of the pain and understand why it's happening. The feeling part of the brain can increase pain when we're worried and stressed. But we can decrease our pain as we become less fearful of pain and more hopeful. We sense pain differently when we start to move less. We start to feel pain in bigger parts of our bodies. But as we begin moving again, the sensing part of our brain returns to normal. Avoiding movement increases pain when we expect more and more things to hurt. But as we slowly get back to doing things, this part of the brain also quiets the pain. So all of these things together can work in your favor to quiet and decrease your pain.
The good news is there are a lot of very effective ways that we can change our relationship with pain. We can change our diet and our exercise. We can learn relaxation, focus, and breathing techniques. We can spend more time with friends and family that make us happy. And we can get back to hobbies and activities that we enjoy. The physical therapist can also teach you specific techniques for learning to move again.
I want to practice them every
Pain
day.
patient Kathy
I wanna have
Sargent
focus
worked
on
with
the
Providence's
sensations in your body
persistent
that
pain
aren't
program
pain.
to do just that.
So we're going to start with walking. And we're going to start walking here, and you'll just walk at your regular pace, okay? And I want you to just tune into the sensations in your body, how your feet are hitting the floor. Again, work on the fluid and easy movement of your spine. You'll be dropping your head to start with. You'll drop your head and drop your tailbone and lift your torso. And breathe, and then switch. And breathe. Good. Focusing on the breath, focusing on the smooth and easy flow.
It is possible to return to activities you enjoy. That doesn't mean eliminating pain altogether. Instead, it means understanding your pain and changing your relationship with pain.
And not high, but long and strong. Breathing in.
Mary, the physical therapist that I worked with at Providence, taught me how to accept the pain first. Accept it, embrace it, and then we'll work through it from there. This weeding's good for me because all the roots that have been holding this crud in here for so long is like the pain, you know. My rear end grew roots to that chair in there on that heating pad. And now that I'm out here able to pull these roots, feels like my roots have been pulled up and moving again, so it's a good thing.
Here are some ways to decrease your pain. Learn how pain works. Try relaxation exercises. Assess your physical activities. Modify, vary, break into smaller segments, add gradually. Start doing more things you enjoy. Reroute your brain away from the pain message. Make changes in your diet and sleep patterns. Most importantly, this is a process, so be patient with yourself.